Hi everybody, Dr. Britt Talley Daniel MD. I'm a neurologist and headache doctor. Trying to keep up with the news, so I'm posting an article today on something really new. It just came out here in March of 2020. The talk today is going to be on, does Reyvow or lemistibidine treat migraine? I'm just going to use the name brand drug named Reyvow. So migraine is a very complex neurovascular disorder. It affects 25% of women and 6% of men and 12% of the world population. It can be disabling. It can be either episodic or it can be chronic. 4 out of 5 patients who have migraine have severe pain during a migraine attack. The migraine has to do neurochemically with serotonin in the brain. And the drugs that activate serotonin will provide treatment. So this new drug, Reyvow, is classified as a serotonin 5-HT1F receptor agonist, and it's called a DITAN, D-I-T-A-N, because it has lemistibidine in the name, in the generic name. So an agonist is a chemical that binds to a receptor and activates the receptor to produce a biological response. So this drug activates the release of serotonin, which helps migraine headache, and that's kind of how it works. So the question here today to ponder would be, does Reyvow for migraine help? Does it work? Is it good for treatment? And the answer would be yes. The FDA has released Reyvow, the first and only DITAN, for acute therapy of migraine headache with or without aura. Now this drug is not indicated for prevention migraine. It's for acute therapy drug. So what is the site of activation of this drug? Well, it binds with high affinity to the receptor, the 5-HT1F receptor in the brain, which is in the trigeminal nerve and in the arteries. And it's believed to act both centrally within the central nervous system and peripherally in the arteries. What's the dosing? Well, I have 3 oral doses available here. There's a 50, 100, and a 200 milligrams. And they don't really specify in the product information sheet how much to start with. So I guess most doctors would start low with 50 milligrams, see what happens. If it doesn't work, go with 100. The next time try 200. The only one dose of anything they say should be taken within 24 hours. So if you take a 50, you're committed to 50 for that 24 hours. A second dose is not effective for the same migraine attack, they say. And they've also stated that the safety of treating more than 4 migraine attacks in 30 days, that's a month, has not been established. So you get 4 treatment days a month, it looks like. So what were the research trials that showed the effect of this drug and how it worked? There were two trials. They call one of them Spartan and the other one they call Samurai. And they looked at pain freedom and MBS. And MBS is a mnemonic that refers to migraine symptoms like photophobia, sonophobia, and nausea. MBS is those things. So the Spartan study gave 50 milligrams and they found pain-free response at 28 for 28% of patients. And the Samurai group showed 15%. The Spartan group for 100 milligram tab showed 31% response, pain-free. The Samurai showed 28%, and the 200 milligram dose in the Spartan study showed pain-free at 2 hours for 39%, and Samurai at 32%. There was a placebo response for one study, 21%, and the other 15%. So that's pain freedom at that for 39% for the 200 milligram dose. All right, MBS freedom. This is freedom from sensitive to light, sound, and nausea. The placebo response is about 30%. The 200 milligram tablet had a 41% response in both studies, which is pretty good. So, because the FDA gave them a rating for acute therapy for migraine, they also listed a group of adverse reactions. I'm just going to have to read this off my sheet here. Adverse reactions for dizziness was maximal for the 200 milligram size of Reyvow. Fatigue was max at 6%. Paresthesia, again with a large size pill, 200 milligrams with 9%. Sedation was present in 7% at 200 milligram, and nausea and vomiting only 4%. So the most common adverse reactions through this whole study were about 5% patients had reaction to it, where the most common things were dizziness, fatigue, paresthesia, which is numbness and tingling, like face, arm, and leg, or something like that, and sedation. All right, are there drug contraindications, drugs you should not take with this medicine? If you're on a drug that lowers your heart rate, like if you have high blood pressure and you're taking propranolol, which is a beta blocker, then you shouldn't take a drug like that. And it shouldn't be given with what's called PGP, breast cancer resistant protein substrates. That's abbreviated BCRP. If you're taking any of those, you shouldn't take this drug. All right, what's the use in specific populations, like in pregnancy? Well, there are many data on this in pregnancy. So it's been found to harm rats in animal studies. So there's no advice to treat it in pregnancy. There's no data on lactation or breastfeeding either. Apparently it doesn't come out in breast milk. And consideration of using it in a woman who's breastfeeding has to be balanced against treating the migraine, which can be a disabling, horrible condition, and a possible small side effect. Persons who have severe hepatic impairment should not really try that drug. Pediatric dose, which could be less than 12 years old persons, there's no safety effectiveness data on that at all. Geriatric juice, the most common thing there was dizziness in people over 65, and well, there was a dose-related effect there, so it was better at 50 than 100 and worse at 200 milligrams. But of course, always in medicine, you want to try the lowest effective dose. What's important safety information? Well, the big thing here is a single dose of Reyvow may cause significant driving impairment due to increased sleepiness lasting as long as 8 hours. Wow. Therefore, because of this possible side effect, patients are advised to not perform potentially hazardous activities requiring complete mental alertness, such as driving a motor vehicle or operating machinery, for 8 hours after each dose. So if I got a migraine at 4 o'clock in the afternoon at the office, I couldn't take this drug and drive home. This product information sheet stresses that patients who cannot follow the 8-hour non-driving recommendation shouldn't take the drug at all during that time. And prescribing physicians are supposed to stress this when they write prescriptions to the patient. This drug is also a Schedule 5 controlled substance. So it had mild human abuse potential when it was studied in a drug forum, that subjects gave a higher liking scores for Reyvow than placebo, so it has a small abuse potential. However, the amount of liking that patients did for this study was less than for alprazolam, which is also a class 4 narcotic, a benzodiazepine drug that's used for anxiety and panic disorder. All right. Feelings of euphoric mood and relaxation were reported with the use of this drug, but no physical withdrawal observed in healthy subjects following cessation of their drug, using it for 7 days. That's just a short-term study. All right, warnings and precautions. Well, CNS depression, as I've already said, with sedation can happen. And it can also cause central nervous system depression, sedation, and dizziness. It should be used with caution with any kind of alcohol, any kind of drug like tramadol, hydrocodone, anything like that, or any of the drugs, acute therapy drugs for anxiety, the benzodiazepine drugs like Valium, Xanax, Librium, or Ativan. There's also a rare finding of serotonin syndrome, in that it caused reactions consistent with serotonin syndrome in clinical trials. And the symptoms here are mental status changes, autonomic instability, neuromuscular signs, and GI symptoms. The serotonin symptoms are onset within minutes to hours after dosing, so it's found to be only if you use another serotonin drug. It also can cause medication overuse headache. And this is a problem with migraine, usually overtreat with NSAIDs, Tylenol, Advil, any of the triptans, any kind of narcotics. The worst drug for medication overuse headache is butalbital or a drug like Fiorinol. No one should ever take that for a headache. So in general with headache, you're not supposed to take anything more than 2 days a week, caffeine, Tylenol, triptans, or anything like that. And I suppose the same thing would be said about this drug, no more than 2 days a week. If not, then you can develop daily or chronic headache. And as people know, I think, are learning now, the treatment of medication with headache is patient education and drug withdrawal. I got a great article on this on my web page at www.drmigraine.com, so go read some of that. Now, another comment would be, It's going to take some time to see how this sorts out with the 8-hour driving prescription after taking the medication. I'm not sure what's going to happen there. We don't have any data. The drug just came out. Triptans probably work about 2 to 3 times better or more effective than this drug is. So patients, 69-70% of patients respond to triptans. Most of those persons are going to want to stay on their triptan for acute therapy for migraine. But you've got about a 30% group of patients who don't respond to triptans, and this drug may be helpful there. Also, triptans are contraindicated for persons that have cardiovascular disease like coronary artery disease, untreated hypertension, angina, previous chest, a heart attack, previous stroke, or TIAs. Those group of patients really shouldn't take triptans. The doctor shouldn't give it to them. And so here's a drug that could be used in that situation, possibly. Now, again, no studies have been done to see that, but the CGR group of drugs that we have out now have been found to be pretty free of cardiac side effects. And I'm just generalizing from this drug to other drugs in that same class. CGRP drugs seem to do okay with heart trouble. We'll see if that's going to happen. That's not been published yet. That's just my opinion, kind of. All right. It does give the doctor another kind of treatment in his black bag to treat patients with migraine, because they're always using something we could help. So this would be a drug for the 30-40% of patients who are non-triptan responders and patients that have cardiovascular disease. So that's the end of my report on this. God bless you all with migraine. I'll see you again on the next visit, and please click on my subscribe button down there. Appreciate it. See you now. Bye.